Hey, it's Dr. Vane. I wanted to show you a really cool case that we just finished up. This patient had a root canal that was redone 2 or 3 times, and it still had this residual infection around it. And I want to trace it here that the infection, what we say, blew out the bone. It comes all the way around. This is his lip and came all the way out through his lip. And when we go to a different portion of the scan, you can just see how it's sitting in infection here and there's sitting in infection here. So what we did that I was like super thrilled with, because he wanted something that was completely of self and biocompatible. So I took out the tooth and I used Ribond, which is a polypropylene fiber, and cut the root off of his natural tooth. And then we were able to splint it in place to the backside of his other teeth. So he left, leaving with his same tooth in the same position without the root and infection. And then we used bone mixed with his PRF, packed it all the way down into the site. It was a huge defect. And then we're gonna wait and see. He can use this crown, his own tooth, as the restoration for as long as it lasts, which I have several of these in function for 5+ years. But the exciting part is we cleaned out all of the infection. It was very extensive, like I said, and we were able to replace the tooth the same day with his own tooth. And a lot of times what's really cool is when we amputate the root, because this root is of self, the tissue will actually form around it. So you won't get that shrinkage and collapse of the socket. And it'll actually look like that tooth is still growing out of the socket. So anyway, some cool things happening here at Moonlight Beach Dental.